All right.
Okay, so could you please just first state your name and your career?
Yes, my name is Micaela, and I am a current pharmacist and actually completing and finishing up my first year of residency at Wake Forest Baptist Health. And I'm starting my second year of pharmacy residency at Duke University Hospital on July 1st. And I'm also known as the Faithful PharmD on Instagram.
Yeah. So what like area or field are you completing your residency in?
Great question. So I am completing my residency in a term called ambulatory care, both first year and second year. And I know this sounds a little confusing. Most of the time, residents will complete a generalized residency their first year and then specialize their next year in something different. But I was able to get a ambulatory care focused residency the first year, and then I'm going to focus in different areas of ambulatory care in my second year. And I say the word ambulatory care, I want you to think of practicing in a clinic with different healthcare providers. So doctors, nurses, PAs, or nurse practitioners. So an interdisciplinary healthcare team.
Hmm. So my other question for you is just like when and why did you first decide to become a pharmacist? Like why did you decide to go into this field? And yeah, basically.
Perfect. Okay, so I knew that I loved math and science and healthcare when just math and science first. My sister was 9 years older than me. She kind of directed me into pharmacy. And then as I got older and closer to the field, and this was from 12 until high school, I kind of knew that I wanted to go into healthcare, but I did not like the blood and guts aspect. And that's what led me to pharmacy. And I would volunteer in pharmacies in high school to kind of get my feet wet. And when I really got to pharmacy school is when I learned about residency. So that's what led me to the field of pharmacy.
So, just like talking more about your journey to getting to this point. Um, so, um, so I was wondering, since you mentioned like how your sister directed you to this path, did you know in high school if you wanted to go into this field specifically?
Yes, definitely. In high school, so a little bit of backstory. I decided I wanted to be a pharmacist at 12 and kind of went forward just in that direction and knew I could pivot as needed with my interests or my personality type. So I wasn't, dead set on pharmacy. I just started in a direction. And then as I got toward high school, and definitely in high school, I knew I wanted to pursue pharmacy just from the the experience that I got with it. I tried to shadow as many people as I could, or I volunteered in different pharmacies. And then I also um, played softball very competitively and leading up to that point. So I started at 8 years old knowing that I wanted to be a college athlete, specifically in softball. So I started with softball and pharmacy, and that's kind of how I got to the point where I got to high school and I knew, okay, I'm going to be recruited to play college softball. I also want to really focus on my academics and make sure I'm a strong candidate for applying to college, and then also pharmacy school after that. So that was my journey from, elementary school all the way to high school.
Mm-hmm. So, I just wanted to ask more about like in high school, if you like specifically took like any medical or healthcare related classes and any kind of extracurriculars related to like medicine and healthcare.
Very good question. So I wouldn't say I took any extra classes. I don't think that was really an option when I was in high school. I graduated in 2013. I just focused on, graduating with good grades and being a strong academic student. And I tried to get involved in different organizations that were healthcare related. And then I also have an interest in entrepreneurship, which is kind of how I started the Faithful PharmD. And so I was involved in organizations relating to that, mainly two. I think there was a healthcare organization I can't remember the name of that I was a part of in high school, and then an entrepreneurship organization I was in high school.
So, once you got into like college, I was wondering like what major you decided to major in and why.
Very good. So for the PharmD degree, for a pharmacy degree, you don't necessarily need a a bachelor's degree. You can just satisfy the prerequisite courses, and that just means the pharmacy schools require you to have so many courses, and then they check off your grades on those courses, and they summarize you as a candidate based on your academic performance and then your extracurriculars, being well-rounded as a candidate, and then they offer you an interview, and based on the interview you get accepted or not accepted into the pharmacy school.
Mhm.
So, oh, I'm sorry, I didn't answer the question. I have the questions over here to the side. So the question is, I decided I wanted to play softball, so you could do the prerequisite course in 2 to 4 years, and I decided to play 4 years of softball, so I majored in biochemistry and played softball. And those, I met with an advisor. When you get to college, you'll get an academic advisor. And he really directed me toward biochemistry because it satisfied a lot of those prerequisites naturally. And it was a great healthcare uh, degree to go anywhere. If I wanted to change from pharmacy down a different path, it really set me a great foundation to go anywhere I wanted to go. And that's how I chose biochemistry, and really why I decided 4 years rather than two was the softball piece, because I wanted to continue my softball journey and finish playing the Division II college softball career at Queen's University of Charlotte.
So yeah, so you mentioned softball, and I was wondering if there were any other extracurriculars and activities you like really focused on during college.
Yes, okay, during college. So I would break down the extracurriculars into the application processes. So I would say the college application process, we've already talked about that. So I'm in college now. So my next application process is pharmacy school. And then after that is residency. So for pharmacy school, as I was prepping in college, I really immersed myself into organizations outside of softball and then academics. So I would say I would recommend a student in college to be involved in 2 to 3 extracurriculars, and invest especially in one area to have leadership positions to really be a strong candidate for the application process in pharmacy school. So my first area was college sports. My second area was the Pre-Health Student Association, and that was just an association of all college students who wanted to go to graduate school in a healthcare field. So doctors, veterinarians, pharmacists, nurses, anything in the healthcare field. So I really invested in that one to try to have a leadership position. So my first year, I was the historian, and basically, a lower responsibility position. And then I worked my way up to the secretary or vice president. And then by my third year, before the application process, I was the president. And then the third area that I was involved in for extracurriculars was the Rotary Club, or the Rotaract Club. That was kind of an entrepreneurial club that I was involved in, that my friends were also involved in, but I was mainly a member there. And so when you think about the application process for residency, you kind of need to do the same thing you did in college. So I invested into several organizations, and I would again pick 2 or 3, and then kind of specialize and try to be a leader in one of them specifically, and maybe hold a lower responsibility leadership position in another. So for example, I was in 4 major organizations, but only members of 2. So I just went to meetings of 2. But it was the American Pharmacist Association, which is a national organization, very large. The second was a state organization, the North Carolina Association of Pharmacists, or NCAP. The third was, let me think, definitely the CPFI, so Christian Pharmacist Fellowship International. And then I think there was another one, but I'm just going to focus on those 3. And so where I looked to gain leadership, oh, it was the Ambassador Organization. Okay, Ambassador Organization. So I tried to gain leadership in the ambassador organization, and the ambassador program was tied with the admissions team of my pharmacy school, and I really enjoyed my connections with them. So that's why I really invested into that organization specifically. And we would give tours to prospective pharmacy students, or we would host the what is it called? The onboarding class. We would create the orientation for them. So I became the Welcome to Wingate chair, where I created, designed, and then implemented the orientation for the next class. And then I was the president of that organization by my fourth or third year of pharmacy school, because pharmacy school is 3 years in the classroom and 1 year out on clinical rotations. And so in the other organizations, I was just a member of all of them except for an APHA. I was the immunization chair. So it's just a chair, or another step up from just being a member, just to be well-rounded. And then on the backside in college, I would work in a pharmacy to just show my interest in pharmacy and things like that. So those were really my organizations that I was in college and pharmacy school for the application process that was to come.
Hmm. So just talking more about like the application process to pharmacy school, could you talk more about like what the timeline looks like really?
Good question. So I would be someone who couldn't speak as well on the entire timeline for the application process, because I decided to do the early decision pathway. So the application process in its entirety is completed through an online application system called PharmCast, PharmCas, PharmCast. And what happens is you make a profile, and you have to get some things together like letters of recommendation and take a PCAT, maybe or maybe not, depending on the pharmacy school. And it'll have all the prereqs, and you click your pharmacy schools. But you could decide to do the early decisions pathway. So you really start, I think you start getting ready in the summer, sometime around June. And then the early decisions pathway is due in September. So if you decide to do early decisions, and the reason I decided was because I wanted to go to pharmacy school close to home, so that I could go home and get revitalized and then go back to school, because I grew up with horses and I was really close to my family. So that was just the reason I chose the early decision pathway. So with that, if you decide to do that and you get accepted, you're in a binding contract that that's the pharmacy school that you are going to go to. If you don't do that, I would recommend, or if you're not interested in that and want to learn more about the other process, I would just Google pharmacy school application timelines. And there's a lot of great resources. I started looking into it as I was prepping for the interview. But basically, before you apply, you're going to want to look into the pharmacy schools you're interested in applying to. Think about taking the admissions test if the pharmacy school you're looking at requires it, which is the PCAT, PCAT. And then start thinking about letters of recommendation from your college professors. And then make sure you're paying attention to when the PharmCast portal opens, and you'll be just fine.
That sounds good. So I'm just moving like along through the journey. So now talking about like pharmacy programs. So I was wondering what your pharmacy program looked like, because I know like different pharmacy schools specialize on different kinds of like education. So
Yes. So my program, I'm not sure what other programs do, but we had 3 years in the classroom, like I mentioned, and we would have our clinical rotations peppered in throughout the year. And so I think it got more intensive as you got closer to finishing. And by the fourth year, you were all clinical rotation and no classroom. But on the backside, you're studying for your 2 final board exams. And the 2 final board exams you're going to have to take is the 6-hour NAPLEX exam and a 2-hour law exam. And the NAPLEX is just looking at all the clinical things you learned in school and on rotations. And the law exam is the whatever law you want to be licensed in. So North Carolina is the one I took. So in the I guess in the classroom, you're just learning different clinical specialties, and you start out basic overviews, and this is how it did in my pharmacy experience. I think they've even changed it now. And then you would specialize into different things like cardiology or renal, so the kidneys and liver and all those things. Um, but now I think they integrate them throughout. And then you would have like a short or an easier rotation your first year, something that wasn't so time consuming. And then the rotations would get more time consuming as you got closer to the end. So you definitely have to be able to manage your time well. You're going to be studying a lot when you're in pharmacy school, but I did have time off and I did have a life outside of pharmacy school, but it's definitely an investment in your years during that time.
Hmm. So, could you like speak about like what an average day look like for you, maybe during like your clinical rotations?
Yes. So do you want that now as a resident or before as a student?
As a student in like pharmacy school.
Very good. Okay. So as a student, my clinical rotation day would be, so the first year you're in a community-based pharmacy, and that's what you think of when you hear the word, when you think of a pharmacist, you're thinking of community pharmacy. So a pharmacist working in Walgreens, for example. You in your first year, you would maybe, I can't remember how often you went. It was 1 to 2 days a week, maybe for a couple hours after your classes for the day. So mainly your classes are from 8 to 3, and then you'll have a lab in the afternoon on 1 or 2 days a week that'll hold you a little later. And then if you're doing rotations, that might replace your lab, for example. So you would go to class, then you would go to your rotation. So you get out of class at 3, you go to your rotation from 4 to 6, 2 times a week. And then in your second year, maybe you're having school, some days are heavier than others. So for example, Tuesday, Thursdays may be a really heavy class day where you're in class from 8 to 5. But Monday, Wednesday, Friday, you're in class from 8 and then 8 to 9, and you have a break, and then you're in class from 2 to 3, and it's easy, so easier days and heavier days. And then in your second year, I would say your second year of pharmacy school is maybe the most rigorous because the classes get harder and you're spread a little thin with your rotations requiring more time. So then you have to go to rotations after your coursework day. So say you get out at 3 and then you go to rotations maybe 3 times a week or 4 times a week for a little bit longer period of time. Or sometimes they'll have you completely take your Tuesday and Thursday and you're in clinic all day. So you're going on your rotation all day, Tuesday and Thursday, instead of going to class. And they set your schedule up so you're not missing any class and you're supposed to be doing that. But you definitely have to be able to manage your time between like working and being in the classroom. And that's why pharmacy school and residency programs really like to see that you did a little bit of work while you were in school to show that you can manage your time well in and out of the classroom.
Mhm. So my next question was about like what an average day has looked like for you during residency.
Good question. Okay, for residency, this is completely different than being a student. And I had a lot of classmates, decide not to do a residency because you do get paid less as a resident than you would if you went straight into the field. And it is similar to being a student, but you are getting paid and you are just on rotations at all times. And not only are you on rotations, but on the backside, you're doing longitudinal projects. And that just means long-term projects. So this is a research project that I'm getting published like this week, a medication use evaluation, and this is just a quality assurance assessment of different processes going on in the pharmacy. So my research project was on pharmacist recommendation acceptance rates in a new process of pharmacists in this area. So these pharmacists were making recommendations to different providers throughout all of Wake Forest, and I looked to see how many of them got implemented, and it was a really good finding. So we're going to go on and publish it. And then my medication use evaluation was looking at proper prescribing techniques of 2 classes of medications, and just to see where we could be doing better, what we need to do to make our process better. And then I also like teaching in pharmacy school. I took my fourth year, I took an academic elective where I was able to teach pharmacy students. I really enjoyed it. So I pursued a teaching certificate in my residency program. So I was also doing requirements for that on the backside. So I would teach at a pharmacy school or provide lectures to my classmates or different things like that. That is, so a day in the life. I had longitudinal rotations in my current residency program, which is very, very unique. Most of the time, rotations are 4 to 5 or 6 weeks long, and you're in that area, and then you move on to another area, and you no longer talk to or think about that previous area. You just keep it in your brain for future knowledge and move on. So my program was, I was in a different clinic every day of the week, so Monday through Friday, and it was a different physical location as well. And I did that for the entire year until the last 6 weeks where I did an elective that I wanted. So my day one would be in an underserved clinic. Day two would be in a very wealthy patient population clinic. Day three might be in a telehealth-based clinic. And then day four would be kind of variations of those really underserved, or maybe a mixture of, not as underserved and very underserved, just different areas with different providers. And then my last 6 weeks, I did a heart transplant, heart failure elective because I really like cardiology. So that's really what I'm finishing up right now. So that's a day in the life for that. Looks like I'm going on rounds with the medical team, and then in the mornings, and then in the afternoons, I'm working in the clinic, seeing patients who have already been transplanted, and I'm looking at their meds, talking to them. So I really like teaching and pharmacy in general because I like talking to people. So that's kind of what led me to ambulatory care, because you see a lot of patient interaction and things like that.
Mhm. I just want to say congratulations on your upcoming publication. That's very exciting.
Thank you. I appreciate it.
So I want to talk about like you mentioned, like I see pharmacists all the time, like in local Walgreens, like CVS, and you can also see like pharmacists at hospitals as well. I was just wondering like if you've thought about what area you're going to like work in after you finish your residency.
Good question. So I worked in retail. Did you say the word retail? I think you did. Or was it community? I would be impressed if you knew the words. I think you did. So I
I
worked,
don't think I did. I don't know the exact words.
I think you did good. I think you did good. So I worked in community, and I realized that was not for me, which led me to pursue a residency because I could have gone directly into community pharmacy like a Walgreens or a CVS after pharmacy school. So I really knew I wanted to use my clinical knowledge and be almost like a doctor that was a pharmacist. So in North Carolina, we're very progressive, which is where I practice currently, where we can practice under a collaborative practice agreement. It's abbreviated CPP, where we team up with a group of physicians or a physician, and we say, hey, we're going to see these patients, for example, for high blood pressure, diabetes, smoking, COPD, and asthma. And we're going to prescribe this set of medications under your supervision. And they okay what we're allowed to do, and we say what we're allowed to do, and we go into a CPP or collaborative practice agreement where I can work as a doctor in a clinic, like a walking ambulating patients walking in and out of a clinic. I see the patient, I say, oh, your blood pressure is a little high today, maybe we'll increase your blood pressure medication, or it's already increased all the way, we're going to add on this second blood pressure medication, or maybe we don't increase or change your medications, maybe we look at having you walk more or change your diet. So that's the type of pharmacist that I see myself being in the future, and that's what I'm trying to gain by completing these 2 years of residency. So that is my dream. And then with pharmacy, and I'm sure any other career, you can pivot as you go. So I really like teaching. So I could see myself working in a clinic with a group of providers and being one of those providers that sees a patient and prescribes medications, and then maybe transition to teaching in the classroom. And as a professor in pharmacy school, you could teach and also work in a clinic. You could only teach, or you could only work in a clinic, and then you'd have students come and be on clinical rotations with you, and you'd be teaching the students. So there's a lot of different routes. Or in pharmacy, you could do nuclear pharmacy or research or work as a medical liaison for a drug company. There's a lot of different avenues for pharmacists, but you just got to see what you're interested in and kind of have your personality and your strengths guide you to your future job.
Mhm. So the other question that I had was just after residency, do you plan on gaining like any other kinds of training or certifications?
Good question. So it looks like you've done your research. I want to become an ambulatory care pharmacist. So I want to get 3 specific certifications. One is board certified ambulatory care pharmacist, abbreviated BCACP. And the second, I really like diabetes and hypertension, which is also known as high blood pressure. So I want to become a certified diabetes care and education specialist, which is CDCES. And then lastly, I want to practice at the top of my license with a collaborative practice agreement, like I mentioned, being able to work with physicians under their umbrella and then prescribe and see patients independently as a pharmacist practitioner.
Mhm. So so I was just wondering if you have any last piece of advice for like aspiring pharmacists who are also like kind of looking to go into the field and work directly with patients.
Good question. So the first piece of advice that I have is perseverance is key. I think that it's going to get hard no matter what path you decide to go down, even if it's not healthcare. And it's important to have, not only you're working really hard to achieve a certain goal, but also have a good balance and rest, and think about a pendulum swinging back and forth. You're going to be working and then you're going to be resting. So make sure to not get so bogged down in the works that you can't go and rest and get revitalized, because that will keep you going toward your goal for the long term rather than burning out when you're up against some difficult times or difficult years. And then the second piece of advice is I named my social media the Faithful PharmD because of a specific story. So during the application process, it was very difficult and there was a lot of unknowns. I could have been anywhere in the world that I applied to, and the process is kind of very vague. So you send out your applications for residency, and then you get offered interviews back by different programs. And then the programs match the candidates, and the candidates match the programs. So I interviewed with 4 or 5 for my first year, and I ranked them. And then you go into a match system where the computer just matches you with a program. So you have no idea where you're going to be. All you know is what I put on the paper I could potentially be. And I remember I was going through the application process, and I had just gotten denied from my top program that I was really excited about. And I remember sitting on the couch with my parents and saying, I just can't see it. I just can't see it. And I went back to, or my parents really brought me back to perspective of, you have to have faith. You have to have faith that it's all going to work out in the way that it was meant to work out, not just, you can't do it all yourself. So that's why I became the Faithful PharmD, because where I ended up was way better than the plan I had for myself originally. And then if you have any hesitations about if you're qualified to get admitted into pharmacy school, I started getting worried my sophomore, junior year of college, like, are my grades good enough? Am I a strong enough candidate? And so I went to the admissions team and I emailed them and said, hey, it was over one of my breaks, maybe Christmas. And I asked them to meet, and they reviewed everything and kind of gave me a strategy for being the best applicant I could be for what I had. And they said, you're stressing over nothing. Your grades look great. Like, we're going to take this grade instead of this grade. If I took Calc 1 and 2, they took the higher of the 2 grades. It was a really reassuring process. So if you're ever worried, I would just like go for it head on and try to talk to the source rather than just sitting in your head stressing about that you might not be good enough to get there. And then the last thing I would say is try to get as much experience in pharmacy as you can before you get there, or whatever field you're interested in. Don't just wait and go through school and then realize, oh, maybe pharmacy is not the right path for me. Go try to find anybody that you know, hey, can I just spend a day with you? People love to help young aspiring professionals. So just reach out. We would love to have you.
That sounds really good. Thank you for those pieces of advice. I feel like the part about the faith is becoming more true for me as well. Like just going through like the college application process and all of those things, I have to be like okay with if I don't get into like the college that I want to go to, I have to have faith that everything will work out for me. So that really resonated with me. So thank you for saying that. And also thank you so much for letting me interview today. I really enjoyed talking with you and learning more about this career and field.
Yes, please, you or anybody reach out, message me. I'd love to help you in any way if you have a question in the future. That is why I created my account, was to help others do the process that I went through and maybe not stress as bad. So good luck to you in your college application process. You're going to do wonderful. I know it.
Thank you. And I hope you have a great rest of your day. And
Thank you.
bye.